Hello everyone, this is a wonderful day today and I welcome Dr. Reva Tyagi. It's a great pleasure to have her with us in the DAMS studio. Dr. Reva Tyagi has done exceedingly well in the recently held PGI Chandigarh Postgraduate Medical Entrance Exam May 2016. She has scored a rank of 13. That's wonderful. Congratulations, Dr. Reva Tyagi. We welcome you here at the DAMS counter and formally congratulate you on your performance. Just share with us, how are you feeling?
I'm feeling very happy and very satisfied thanks to the DAMS family.
Well, that's very candidly put by you. One question that I would straight away fire at you, Dr. Reva. How did you prepare for your exam?
My preparation started with joining the DAMS regular batch that I started last year. So I started by whatever the faculty told me, that is going by the recommended books and the notes.
Well, that's very nice and that's sweet of you, and that has definitely earned rewards for you as well. One important question that comes to my mind, and I am sure that all of my listeners and viewers will be eager to know, that how did you manage your time? Because time is the biggest constraint when somebody starts for preparing for tough exams like PGI or AIMS.
Initially, you cannot put in maximum peak hours, so you start slowly and then you take your preparation to the peak. I started with 6-7 hours a day initially, then I started increasing my hours and I took it to 12 hours max during my peak preparation. So that is how I did it. I used to read my notes and then do MCQs along with them.
Well, that's wonderful to know. Dr. Reva, what was the method of your preparation that you have adopted while you were preparing? Was it more selective or more extensive, or was it a combo of both?
It was definitely more selective than extensive because of, like you mentioned, the time constraint. We don't have that much time. So I stuck to all the important things first and then went on to the other topics and I kept it more selective.
Well, that's great to know. How important was DAMS in your preparation?
DAMS is the center of my preparation because, like I said, I started my preparation with the joining DAMS regular batch. Before that, I knew nothing about PG preparation. So I strictly followed whatever they told me in the classes.
Thank you very much for those kind words. And as we all know, DAMS is very active on the Facebook medium, and we have a DAMS exclusive club as well. And DAMS Cloud also available to our students. What is your experience on these?
I was a regular follower of DAMS Club. I used to read all the updates that were put by all the faculty members and shared in the discussions of doubts, and that really helped me learn my subject better. And yes, I did take my online tests on DAMS Cloud, and yes, that helped me a lot.
Well, Dr. Reva, people tell me, all the students who have been, I've been interviewing them from quite some time, they have the opinion that it's very prompt, the DAMS exclusive club. You put a query and say it's a matter of few hours that you get the answer. Was your experience the same?
Yes, it's very, very prompt, thanks to all the faculty members who make it a point to answer each and every of your queries. And a special mention to Deepti ma'am, Sandeep sir, and for answering most of my queries on time.
That's wonderful to know. Let me remind my viewers and my listeners here that I'm talking to Dr. Reva Tyagi, rank 13, PGI Chandigarh Postgraduate Medical Entrance Exam, May 2016. Well, Dr. Reva, as you know, that DAMS conduct a DVT session every year in Delhi at Talkatoora Stadium. Did you attend the same?
I attended the satellite version of DVT session at my hometown Chandigarh, and it was very helpful, and all the visual based questions are really helpful for taking the AIMS and the All India examination.
In what way it was helpful?
Most of the, if I may say, many pictures get repeated. And you get an idea of how the pictures are going to be in your examination, and the phobia of the visual question is reduced quite a lot.
And I hope the questions do come from those DVT sessions.
Yes, they do. Many questions get repeated.
Well, that's wonderful to know. And let me just tell here that DAMS also conduct various CBTs during the year. Did you take any of them?
I took a CBT exam last year that was held in I think September.
Mhm.
And yes, it is helpful. All these exams help you mold yourself, and like I said, to reduce your phobia of the actual exam, and tells you a great deal about where you stand.
Well, that's definitely so, and it's the main aim to conduct such exams is to give you a real picture that where do you stand at a particular moment of time of your preparation. Dr. Reva, we have discussed about the Facebook exclusive club we have talked about DVT session, we have talked about the CBT. Let me ask you, in fact, about the DAMS publications. I'm referring to the Last Look series and the comprehensive review series, and also the Harrison notebook, etc. Please share your opinion with us about the same.
I looked through the Last Look for pathology especially, and the Harrison update for the latest edition before my PGI exam, because PGI is a very subject oriented, you need to know the depth of the subject, so it helps a lot. The Harrison update helped a lot in the medicine questions, and I think I would suggest all the people who are aspiring to go through it if they have the time.
Well, that's very nice to know, and let me remind once again my viewers here that I'm talking to Dr. Reva Tyagi, top rank holder, rank 13 in PGI Chandigarh Postgraduate Medical Entrance Exam, May 2016. Let me just refer, to the DAMS evaluation system. With evaluation system, I simply mean about the grand tests that we conduct monthly, the subject-wise test and the revision tests, etc., which is given to all the students who are the part of DAMS, in their preparation regime. What is your feedback on this?
It's a very good format of all the tests that we keep having, including the classes and the grand test. It keeps you on your toes. You know what subjects you need to revise, especially when you take a grand test. You know which subject you lack in. So I think it really helps you prepare for your final exam.
That's very nice to know. Dr. Reva, you have spent, a good deal of time with DAMS, while you were preparing for the tough exams like AIPG, PGME, PGI and AIMS. What difference did you feel in yourself, what transformation did you find in yourself happening while you were joining DAMS until the day of exam?
I think I really got hold of the subject more, and I felt very confident by the end of it. Before this May exam, I knew that I had read well and that I had prepared from the best notes, and I had taken all the exams and that I was prepared. So I think all this 1 year that I've been with DAMS has helped me grow in confidence.
Great. And would you, I would say, if I say that you became more focused and more spearheaded for these tough exams, would not be, any difference in your opinion as well?
Definitely.
Well, that's wonderful to know. We have talked almost on everything that we offer at DAMS. Let me just ask you, which faculty at DAMS did influence you the most?
I'll be a little biased here because I was focusing on PGI, so Dr. Sandeep Sharma was a big inspiration to me, since he was a rank holder in PGI and since he's from my city. So he kept me on my toes. But the motivational quotes by Deepti ma'am and Sachin sir and everybody, Tushar sir, were always very inspiring.
Well, that's wonderful to know. And once again, I tell my viewers here, I'm talking to Damsonian Dr. Reva Tyagi, rank 13, PGI Chandigarh Postgraduate Medical Entrance Exam, May 2016. Dr. Reva, have you made up your mind to opt for a certain branch, or?
I have two options in mind, dermatology and anesthesiology. I know they differ quite a lot, but I have a keen interest in both of them, so whatever I'll get, I'll choose.
Well, definitely doesn't matter, whatever you'll choose, definitely you're going to excel in that as well. Any message to your juniors before I wind up this conversation?
To my juniors who are already at DAMS, I would say just go by what the faculty tells you. Do not do too much extra stuff apart from what they're telling you to do. Follow your notes, and I strongly recommend DAMS regular course to all my juniors who are aspiring for PG examination.
Well, thank you very much for those kind words, and I am sure that all my viewers are going to benefit themselves by all the valuable inputs that you have shared with us today. Thank you very much, Dr. Reva Tyagi, rank 13, PGI Chandigarh Postgraduate Medical Entrance Exam, May 2016. We wish you all the best in life.
Thank you.